Good morning. My name is Mat Kamil. I'm going to present a paper titled Design and Optimization of Homomorphic Medical Image Fusion Algorithm. The authors are myself, Muhammad Alif Haital Muhammad Marzuki, and Nurul Kamil Ahmad Kamil. The outline of the presentation will be introduction and problem statement, objective literature review, methodology, result, and discussion. The in the introduction, basically that the medical images, the medical scan takes multiple time to detect the possible injuries or diseases, and there will be multiple modalities, different type of scan, for example, MRI, PET, X-rays, and whatnot. And in this study, we are going to use the homomorphic uh, method in order to fuse those modalities. Diagnosing a patient with a single type of image scan is difficult as it will not give complete information. Uh, this is due to the different types of medical image scan which focus on different perspective or outcome of the scan. Medical images often suffer from color distortion, poor illumination condition, and image distortion. Uh, we think that this problem can be solved by using image fusion and homomorphic method, and because these techniques the technique can give best output of fused image. Homomorphic method application can reduce the multiplicative noise and poor illumination by reducing the low frequency component of the image, and also increase the chance of researchers and doctors to identify and giving accurate diagnosis on a patient. The objective of this study, basically, that the study actually this paper is part of a bigger scope of the study, which is study the various types of fusion and homomorphic techniques and select the most suitable for the execution of the project, to develop an algorithm for medical image fusion using fusion and homomorphic techniques, and to validate with respect to the accuracy of the homomorphic medical image fusion algorithm by using qualitative and quantitative method. In terms of the literature review, we'll cover on the medical image field, medical image processing, fusion, and homomorphic. Medical image processing mostly differs from other image processing as the medium as being used is opaque or solid. It's basically that's a human body. Right? Um, the application of chemicals and light rays in generating the image, for example. And the image degradation is different from other image processing due to the composition, the chemical and the material composition of the human body. The different modalities in medical image scan, PET, MRI, X-rays, and whatnot. But in this paper, we are going to focus on the PET and MRI modalities. PET is actually image obtained from injecting small quantity of radiopharmaceutical into patient veins, and nuclear imaging techniques to detect the chemicals in patient body. Normally, that is used for cancer diagnosis and growth, volume detection. The advantage of this PET is that it's used to distinguish between benign and malignant tumor, provides a functional imaging capability and high sensitivity, and it has a deeper, higher penetration depth. Yeah? The disadvantage is that it's a limited resolution, and it use radiation, and the interpretation is challenging. Yeah? For the MRI, which is the create image using radio waves, which is in the FM range, and a strong magnetic that attached to a computer to produce a slice of body parts. The purpose is to scan for of the soft tissues and non-bony parts, for example, blood vessel, even the brain, and abdomen and tendon and ligament tears. The advantages are safe for babies and pregnant women, no radiation exposure, higher accuracy, no short-term effects. And disadvantage is the relative sensitivity to the movement of patient and organs that involve movement, strong magnetic field disturbance, and cannot be used for patients with metallic devices such as pacemakers. The image fusion is a method to fuse two or more input images into a single output image. Fusion algorithm for medical images are based on three aspects that should be in consideration: image modalities, organs to be imaged, and algorithm of fuse applied. Multimodal fusion is chosen as it is widely used with medical imaging because of we have available different modalities of images. Uh, we have two methods, two fusion method, basically that in spatial domain and also in frequency domain. In spatial domain, for example, we use the PCA, principal component analysis, as shown in the diagram, where you have two images and being decomposed into a principal component into eigenvalues and eigenvectors, and then fused together to become a fused image. I'm not going into the details of this. Uh, in the frequency domain, the image are being transferred into into frequency domain using, uh, for example, fast Fourier transform and other transform. So this diagram is for the wavelet transform, since we are going to use the wavelet transform in our in our work. Yeah. So for DWT, the image transformed into DWT and decomposed into low frequency and high frequency component. Then after that, it being fused uh, after uh, being fused in the DWT domain. Then we'll take the inverse DWT to have the fused image in spatial domain. Homomorphic method. Uh, Homomorphic is a transformation of non-linear domain to linear domain using mathematical transformation. Technique of this is one of the technique in image enhancement, and we use the model, the image model, which is the reflectance multiplied by the illumination, so that uh, using the homomorphic we can separate between reflectance and illumination by using log and inverse log, as shown in the diagram below. This is uh, the process flow for the homomorphic filtering. The methodology of this research is that you take the input image and we do the pre-processing, register the image into the database, and we resize the image, the images so that they have the same size. Then we use the transformation technique, basically homomorphic transform and DWT transform, the wavelet transform. Then after that, we do the linear processing. Mainly is the fusion process using the fusion rule and addition rule. And then after that, we go through the transformation, the inverse transformation technique, the inverse wavelet, then the inverse log, which is the exponential. The output is the enhanced and the fused output image. The data set used is from the whole brain atlas, which is situated at Harvard University. We took the 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 images, the PET and MRI images from there. It is actually very we have a limitation to have access to various data sets that's available. Yeah. So we only managed to get this data set for us to use. In terms of the measures to compare whether our fusion is working or not, we use the qualitative and quantitative measures. For the quantitative measures, we use a mutual information where we take the summation of the joint distribution random of the two images, which is x and y, and all and take the log uh, of the ratio of the joint distribution over the product of the marginal distribution. This is uh, the diagram or the flow of our improved uh, homomorphic fusion technique, where if you compare to the DWT technique, it looks a bit different because we have the log transformation added into it, and also the decomposition. Uh, we categorize we split it into the high pass and low pass, where the high pass we take all the decomposition component, which are having the high frequency uh, component. So we have the low high, high low, and high high. And whereas for the low pass, it's only the low low frequency component. We did this because we don't want to use the information of the reflectance information, because most of the illumination are in the low frequency, whereas for the reflectance, we have the at high frequency and also at a low frequency. So therefore, all the components that we have, all the decomposition which has a high component, we we go through the high pass. So we want to preserve the high frequency component, and we want to what do you call it attenuate the low frequency component. And then after that, we go into the fusion rule. We can use a few fusion rules in this case. Uh, for this particular project, we use the average and the max fusion rule. Then after that, we go into the inverse DWT and inverse log in order to get the fused image. These are the fusion rules that we have: the averaging, weighted sum, product, max, and mean. In this case, we use the average and also the max averaging, max fusion rule. Uh, different combination can be used, can be studied actually, in order to get the best um fusion rule for our application. Result and discussion. Uh, for the qualitative measures, if you look at from the output of the three method, DWT, PCA, and homomorphic method, we can see that the homomorphic method have a lot more information, where you can see the component from the MRI and the component of PET are fused into the images. For the PCA, not much information from the MRI is there. And for the DWT, it's actually in the middle between the PCA and the homomorphic. Uh, we did this test for three regions: region 1, region 2, similar qualitative observation that we can that you can see, and same thing with the region 3. Uh, in terms of the quantitative measures, we can see that homomorphic DWT method has the best MI. In conclusion, input fusion, image fusion can decrease the amount of data by combining the characteristic of data or into a single data or single image. This also shows that the homomorphic method can be done with the existing method and image fusion, and homomorphic method can be used in image fusion application as an image and detail enhancement, and different types of image fusion brings different accuracy and efficiency. The limitation for this study is basically that in order to get the test the data set, because the original uh, plan was to have four different modalities uh, to be fused, and that will be a future enhancement for this study. Okay. This is the partial list of the references, and thank you. And now I open for question and answer. Thank you for your attention.